I had an interaction with a patient a couple of days ago that I just can't get out of my mind. She's in her mid-50s. She has Medicaid, which means she's limited financially in what she's able to do and pay for. And she has diabetes and high blood pressure and elevated cholesterol, and she has obesity. And that's just a very, very typical patient that I see. And I walked in the room and she said, I stopped my Ozempic and my metformin a few months ago. And I'm sure I had a look of horror on my face. And I said, why? Why did you stop those medications? Because her diabetes had been under incredibly good control. And she said, I'm just sick of taking medication, and I've heard that those medications can kill you. So I took some time and tried to help her understand my reasoning behind using the medication, and by not using the medication and allowing her blood sugars to get really uncontrolled, she's at risk for stroke and heart attack and blindness and kidney failure. So yes, every medication has potential risks and side effects, but not taking medication and not treating chronic conditions also has side effects and risks. And then she said, Doctor, don't you believe that God can heal me? And I said, I absolutely believe that God can heal either in this life or in the next, but I also believe that God has provided the common grace of medications like Ozempic and metformin, but I also know that food is medication. So if you really want to benefit your health, eat a Mediterranean diet and less processed foods, and go see our diabetes educator and our dietitian. You know, those are hard things to say. People want a pill. She said, I really want to take herbs and vitamins to cure my diabetes. And I just said, you know, that's not what I think you should do. It's hard as a doctor too to be on the side of, I know what's best, but there's also a dialogue that needs to happen between patients and their doctors. I don't want to be too paternalistic, but I also want to tell patients, look, I have training that you haven't received, and you've come to me for expert opinion and advice. So I told her to eat a Mediterranean diet, less processed foods, and get back on her Ozempic. And I think we both left the appointment feeling a little defeated and down. So I'll be interested to see what she ends up doing and what she decides.